The Pneumocystis Jerovecii pneumonia is actually a very crazy disease condition that could also affect the lungs and result into pneumonia. Alright, so as the condition is crazy, the medication has to be crazy too. Do you understand? So let's look at the possible treatments for this Pneumocystis Jerovecii pneumonia, right? Which is usually what? Infection of the lungs by Pneumocystis carinii. I think that's the microorganism that is causing that problem. Pneumocystis carinii. So first of all, let's define the condition again so that we just refresh our memory, right? So refreshing our memory, we are saying that the Pneumocystis Jerovecii is a yeast-like fungus of the genus Pneumocystis. It is actually the causative organism of Pneumocystis pneumonia. It is an important human pathogen, particularly among immunocompromised hosts. When they say somebody is immunocompromised, what do they mean? When they say somebody is immunocompromised, they simply mean that the person, the person has some other disease conditions that they are making their immune system very weak. Do you understand? So prior to its discovery as a human specific pathogen, Pneumocystis jerovecii was known as Pneumocystis carinii. Okay, but as they know that this organism actually affects humans, they had to actually switch up the name. Do you understand? So looking at the possible treatment, you might want to use drugs like what? The Trimethoprim or Sulfamethoxazole. Okay, these are the drugs of choice, and they are mostly used in patients, that's HIV patients. Alright, so mostly if you have a HIV patient, then you might want to actually use this type of drugs, right? Then other drugs include when you combine Dapsone and this Trimethoprim, okay, or you combine what? Clindamycin and Primaquine, okay? Clindamycin, Primaquine. Then you also you can use drugs like what? Atovaquone or Pentamidine, and you give it what? Intravenously, right? So I think then prophylaxis. Prophylaxis is like they are trying to prevent the disease condition. This one was actually treatment. Then prophylaxis is like you are suspecting that this patient might have this condition later, so you are trying to prevent. You prevent it using drugs like what? This Trimethoprim and sulfamethoxazole. You can also combine Dapsone and pyrimethamine. You can also use aerosolized Pentamidine. Then you can also use the Atovaquone. Alright, these are the possible drug treatments for Pneumocystis Jerovecii type of pneumonia.